This is part 2 of my interview with Dr. Dominic Carollo, MD, pediatric anesthesiologist at Ochsner Clinic Foundation in New Orleans. Previously, Dom spoke to me about how he shifted his work to the COVID-19 units, what it felt like to have the disease, and what home life has been like. We pick up right where we left off, and we get a first-person point of view of the COVID-19 units, and as you can imagine, it's a difficult scene. Yeah, so, all right, I want to understand what it looks like in these COVID units. You know, when we watch the news, we can see what the inside of hospital COVID units look like, but what's it like to be there and
So
treat
this is what it feels like. So going on the COVID unit of Ochsner, it's the, I'm going to go to the one that I was the most commonly going to, which is the 7th floor, okay?
Yeah.
Go in, and there's two people sitting there that are saying that are monitoring you get on your PPE. So you put on, and if you're going to be in there an hour or you're going to be in there 8 hours, you wear something different. And so I was one of those people that was going in and out. So I would put on that big mask that you saw, the yellow gown, and then double glove, and then go in the unit, take off the outer glove, clean the inner glove, and then put on a new set of outer gloves, like for each patient. That when you come in the door, there's only one way in and one way out. Right when you go in that door, there's room 92 on every floor. That's just the room. It's just call it room 92, and it's about a 20 by 30 room with a glass door.
Mm-hmm.
The weirdest thing about it is inside the room is there's a person laying on a bed with a ventilator towards the door. The door is closed. The monitor, you can see it through the glass window, but all of the medications that are going to the patient are outside the room, and the pumps are outside the room, David. So you see, and that's very abnormal, and no one goes in the rooms. The patients have no human interaction except for maybe once a shift, or if they're not doing well or we have to do some intervention to them. Once a shift or twice a shift, the nurse goes in there and makes assessments, or sometimes the respiratory therapist has to change the ventilator or do some sort of, or suck out the secretions, but very rare. There's very little human interaction. Now these people and they're very sedated too. So it's basically walking around 34 beds with these glass windows, with all of the stuff on the outside, with a human being that is just by themselves in seclusion. And it's sad. It's sad.
Patients in isolation, extreme risk of exposure. It sounds very Chernobyl-esque.
There's also on that unit are people that you extubated, that took the breathing tube out that week. And those people, you're happy. You know, you're like,
they're on their way out.
They're on their way out. But we don't get to see them very long because once they're doing well enough to be happy, they're out the door.
Get out of Dodge, yeah. So what is the range of the severity of the cases?
So you mean by ages, or you mean by so some patients, and I think that a lot of this has to do with obesity, and maybe hypertension. The patients that are the sickest are on these huge high ventilator settings that are very uncomfortable and not at all, not at any sort of realm of normality. Okay, mm-hmm. There's a setting on the ventilator called PEEP, which stands for positive end expiratory pressure. And basically, the ventilator drives in air, and then it leaves a certain amount of pressure there to leave the lungs open. Think of them as balloons. So it drives in pressure and leaves it there, then comes back and drives in pressure and leaves it there. So it goes 40 of pressure, or let's say 365 mLs of volume, 20 of pressure. That's a lot. You and I are sitting here physiologically on room air, breathing on our own, which is negative pressure. And then we have about 4 millimeters of mercury of physiologic PEEP. So there is some PEEP within our bodies. PEEP, that's a normal thing. And right now we figured out like the maximum that your body can PEEP has side effects, and the maximum that your body can really get to is like 20 or 22. And so sometimes then the only next move you have is to flip the patient on their stomach. And that's called proning. And that's a very difficult thing, by the way, that anesthesiologists are the ones in charge of for the entire unit. So we go and we prone patients, or we put them back. It's called supinating, because you put them back supine. And so it's a very uncomfortable thing. And so what's, talking about the physiology of it, it's not normal. And that's why they require a lot of sedation. And then they go into renal failure. And a lot of this is, and maybe we're figuring out that the PEEP is not the right thing. But we know that with lung failure, that PEEP is the right thing. So it's like a tough thing. It's a tough disease. And, we're learning about it every day, thank goodness. There's no recipe for a cure, but there are some things that we think are working a little bit. Maybe they're working. They've been worth trying at least, but you still have some deaths. And that's
So on the COVID units, were you splitting time in your regular practice area of
no
pediatric anesthesiology?
They don't need us, but they didn't need us at the time. Now we're starting to. The governor today announced that starting next Monday, they're going to allow elective surgeries to.
Right, I just read that. Yeah.
And so that's a good thing, and it's probably the right thing. We're not going to ramp up to 100%, not even close. But there are people out there that have cancer that are in extreme pain, that need heart surgery. We have to start doing those services.
And something like that is considered elective surgery?
Yeah, it's not. It's not. They're elective within. So the standard we were using was within 30 days. That's a pretty low standard.
Well, educate me here, because when I hear elective surgery, I think of cosmetic surgery.
That's not what we're talking.
Then I get this redone. That'll be elective.
That'll be expensive. That's a lot of work. That's a lot of work. The elective means that the patient could refuse. Okay, so elective means that they're choosing. They sought this sort of treatment. Now, that doesn't mean that the patient doesn't need it, but it doesn't mean that it's urgent, okay, or emergent. So you have to go in my realm is very specific for babies that need heart surgery. There's kids out there that have a disease called tetralogy of Fallot, and they can grow into being 7 to 9 months of age, but eventually you have to do it. But they have a complication that you have to watch for, and they sometimes can turn blue. They're called TET spells. And there was a kid this week that was having TET spells, so they had to admit him, and we had to do the surgery. And that we just had to do those things. There was a newborn that was born that needed an operation called a Norwood. You can't delay that anymore. You have to do that within 5 to 7 days of life. So we did it, and the kid's fine. And we tested them for COVID just because we didn't want them to have lung disease. And then if we know that if they did get COVID, it would be from the hospital. So we're trying to avoid them from doing that too.
Yeah. The lay people, someone like me, not on the front lines, when I first read that article about the governor of Louisiana opening up hospitals to elective procedures, and my initial thought was, I don't think that's a good idea, because you're risking exposure, but you're there, and you're saying it's the right move. So that's educational to me. And
I do think it's the right move. Now, this is what Ochsner's doing. Let me tell you what Ochsner's doing. Ochsner is testing every patient. You have to get tested the day before you come in for these elective procedures, even these babies. Some of these babies, we are allowing them to be tested after they get there. Okay, so we have a rapid test. Okay, and so if you do test positive, then we're going to take special precautions. And we have 2 ORs that are available just for COVID patients. Okay, and they're walled off and they're separate from the OR. How that all works. But there are kids out there that need their tonsils out and need their ear tubes in, need their adenoids. We have done none of those, and those kids, they need it. They absolutely need it, and it's frustrating for them and their families that these kids are having these symptoms. That's not fair.
Well, and it sounds like your hospital is really one of the best equipped right now. You were mentioning that there's not a lack of PPE compared to what we're seeing in parts of Michigan. and in New York, like Ochsner is a well-oiled.
They've done a good job. They've done a really good job. I've been very impressed. I feel blessed, David. I really do feel blessed, and that's just been lucky for me. That my family was able to provide. I have a full salary. I have they're committed to paying us. I'm going to be very busy come September, October, November. We're still going to the Canes game in East Lansing. All 4 of us are coming. If you guys are joining us,
We are.
Yeah, we're coming to East Lansing because.
Why do you want to put yourself through more pain by watching them lose?
They're gonna lose. It's fine. I don't care about people. I'm used to failure. Please, I'm a Bears fan and a Cubs fan. This was the one team in my life that was not used to failure.
Dom and I are University of Miami alumni. Growing up in Miami, my family had season tickets from the early 1980s through the early 2000s. Miami football was invincible then, racking up 5 national championships. But ever since that bullshit call in the 2003 Fiesta Bowl against the Ohio State Luckeyes, our football program has plunged into mediocrity, and that's being kind. Pictured here are Dom, his adorable son Dominic Jr., and my dad Bod.
Yeah. At least I'm not a Dolphins fan.
Hey, careful. There's much debate over who's worse, the Bears or the Dolphins, but we'll call it a wash. Dom, in literature, a hero is defined as the main fictional character who, in the face of danger, combats adversity through feats of ingenuity, courage, or strength. You're a real-life hero, and I can't thank you enough for risking your life to save the lives of others and to put an end to this pandemic. I really appreciate it, man.
It means a lot, David. Thank you very much. And I feel like I'm trained. I feel like this is my job, but it is the appreciation that people do give us. It's been excellent, and I really enjoyed that. And it is nice just people saying thank you. But I do continue, and I do want to continue to treat my patients, and I hope that I've given them everything, and that's all you can do.
Well, you have.
Thank you, buddy.
And it's incredibly moving, man. You hang in there. Today, Dom is off the COVID units and back to his pediatric anesthesia cases. I also want to say thank you to his wife, Michelle, and children, Sarah and Dominic Jr., for supporting Dom so that he could protect all of us. Next time, I'll be talking to Sandy Frum, Northbrook Village Board President, on what it's like to be in a position of local government leadership during a pandemic.
So things were good, but we had started talking among ourselves about what's next with the coronavirus, because obviously we had heard some stuff. And then I think on March 12th, the schools closed. They made the announcement. So we knew something was coming up.
Thank you for watching. And in the meantime, be smart, be safe, and be well.